Mary Pipino, and welcome to Fit for You, the show that teaches you how to live a healthier and more fit lifestyle. Every show, I try to challenge myself and come up with a new and interesting topic. And today's show is going to be about pain management. Pain is something that so many people have to live with, and you probably think that diet and exercise are truly not that important of a component to managing pain. You're going to be very surprised. I'm going to be joined by Dr. Tom Gemma, one of my dear friends and a pain management specialist, and another dear friend, Bevilacqua, to teach us how to live and manage pain more effectively. Thank you for joining us, and I hope you enjoy the show. We're very fortunate to have one of the best pain management doctors in our area. And I am truly honored to call you my dear friend and to have you with us today. Dr. Tom Gemma, Medical Director for the Surgical Hospital at Southwoods, board certified in anesthesiology, and a specialization in acute and chronic pain management, which is what brought you here with us today.
Yeah, thank you, Mary.
Thank you so much for being here. So many people, doctor, as we have talked about in the past, live with pain, and it's so difficult and such a challenge. And you are so interesting and have, researched and can help them in so many ways that I really thought it was important that we dedicate a show to this with you. So,
well, thank you, Mary. I believe in part of my training and really all of my life, I've had the philosophy that motion is life. And when we stop moving, we stop living. And regarding anesthesia, that seems to be kind of a variant from that, but it actually is part of the whole perioperative process. We like to look at patients before surgery, during surgery, after surgery, and then the conditions that can develop from those surgeries or from prior injuries. That's where the pain management component comes into the anesthesia practice.
And you can also help people that have had no surgeries but are just living with pain.
Correct.
Let's talk a little bit about chronic and acute. What's the difference?
Well, we look at acute pain as those things that happen as a result of an expected injury or illness. If you break your arm, that pain from the broken arm is an acute pain. When we look at chronic pain, we'll take cancer pain kind of out of this picture, but the societies for pain management, American Society of Anesthesiologists, they look at chronic pain as something that continues longer than it ever should. And some people put time variables on it, whether it's 6 months or how long, but if it's your pain and it's lasting longer than it should, it becomes chronic in nature. And then we start to see all the other effects of that chronic pain on our lives. And that's where I am interested in. I like to help people deal with that pain. I like to provide them with knowledge, with information, as well as my technical abilities, injections and things like that we do in a pain practice.
And when I think of pain, I think of a muscle or a joint pain. I think of maybe a stomach ache, a migraine. But you brought out some interesting things when we were preparing, like you say, a cancer pain.
Sure.
You were talking about different head and brain type of pains, things with the digestive system. I mean,
visceral pains. We call those visceral pains, pains coming from organ tissues. And people with irritable bowel, with Crohn's, with ulcerative colitis, with pancreatitis, with liver infections, all of those can lead to their own pain patterns. Lung injuries, lung illnesses. We talked about migraines and different brain disorders. They all manifest themselves in different ways. One of the things I find interesting in my acute pain setting, somebody comes for a gallbladder surgery and we're doing it through the laparoscope. They'll wake up and say, boy, my right shoulder really hurts me. And they don't understand what did we do with their shoulder during surgery that causes the pain for the next 24 to 72 hours after the case. It doesn't come from that at all. It actually comes from the diaphragm muscle that separates our abdomen from our lungs. That diaphragm muscle gets irritated in the laparoscopic process, and it refers pain to the shoulder.
Now, when you say the laparoscopic process, just for our viewers that may not know what that is.
That's where we put air into the abdomen, and we use very small incisions and tiny instruments in order to do gallbladder surgeries, colon surgeries, a variety of things within the abdominal cavity where they put carbon dioxide, something we normally breathe out. We put that in the abdomen so that we can better visualize all those structures.
And that reduces the amount of cutting that you have to do, correct?
The incisions are smaller. The idea is that when we disrupt the abdomen to greater degrees, then that leads to more splinting of the abdomen and longer healing times of those tissues.
You've had the pleasure of meeting Dr. Gemma, and now I'd like to introduce you to, and you may have seen her on a few of my other shows, somebody who I can tell you I truly admire and is probably one of the very best in the fitness industry, my dear friend Bevilacqua.
That's because I've been in it so long.
And there are a few people I truly look up to and admire. You're the person I want to be.
Thank you.
Thank you for being with us. You are the expert, much more so than I am, especially at yoga, a little bit, with the Tai Chi moves. And as we were talking with Dr. Gemma, exercises that involve mindfulness, yes, slow and controlled. And Dr. Gemma, Eve is going to demonstrate some of those. I'm going to let you two chat a little bit about it now and demo what we can be doing for pain.
Sure. As Eve and I talked before about how important the core stabilization is. And some of the techniques that you have are instrumental in establishing that core stability.
And very simple too, Doc. Very, very simple. Now the core, it starts right here above your knees and goes right to the top of the rib cage, front and back, of course, and sides. Now if the core, we can compare the core to a retaining wall in your commercial building or in your home. If the retaining wall is weak, the building falls down.
And you're making a great point. People think of their core as just their abdominal area.
No, it's
so you got to take those legs.
The glutes. Yes, it includes the back, all the way around the body. So this is very important. If this is unstable, you're going to have pain in your shoulders, in your elbows, in your wrist, in your knees. All your joints are not going to be stable because the core is not stable. One of the simplest ways to get the core in shape is a stability ball. And it's got a proper name, doesn't it?
Yeah.
Stability. So if you want to, and you're a beginner, all you have to do is get a hold of this stability ball and sit down. By just sitting down on the stability ball, your back is going to go into a neutral position, already strengthening it. So here you are, folks. While you're sitting watching television, get on your stability ball. Sitting behind your computer, sit on your stability ball. Put your hands right here on your thighs and bounce up and down a little bit. You can feel the muscles in your thighs working. The good thing about this stability ball, Mary, is not only am I working my quadriceps, if I put my hands underneath here, I'm working the backs of my legs as well.
And I'm a big fan of the ball.
Oh, I love the ball. I love the ball.
And I think the other part that's important is without realizing those erector muscles of the spine are also coming into play. Absolutely. By maintaining the posture that you're in.
Absolutely. And your abdomen. You're automatically holding your abs in when you're on here. So all you do is have a seat. Slide side to side. Slide forward and back. Do a couple of nice little easy stretches. It's such a simple thing to do. Once you feel more stable on here. Now let me ask
Dr. T, if you cannot sit up on, because to some people this is not an easy move.
Yeah.
Can you give us a little bit of, how should we get started if you can't get all the way up, if you can sit straight?
And Eve can correct me if I'm wrong, but the size variability of these balls, I think, comes into play. For those that can't get to those positions, there's bigger balls, there's smaller balls. So as you progress in your development of this, you can change sizes of the ball to fit your abilities.
And as you bring up the size, Eve, why don't you comment, we like a ball, and you can comment where you're at a nice angle with the knees. You want to explain?
Yes, the knees and the hips should be in a pretty straight line. If the buttocks is lower than the hips, it's all right, but if the buttocks is lower than the hips, you're going to be working a lot harder. So for a beginner, you want to make sure that the knees and the hips, just like mine are right here, my knees and my hips are in a nice straight line. The wider apart your legs are, the more balanced stability you're going to have. So a lot of people are going to get on this ball. Always remember to get on the ball this way. When I teach ball, a lot of people want to do this to get on the ball. Come around the front and have a seat on the ball. By the way, it'll hold about 300 pounds, so don't be afraid of it. You can get on it.
Most of us can fit on the couch.
Yes.
And that's about couch height, and I think that puts us all in about the same plane. So I think that's a great example of somebody that's just starting out in this technique to be able to develop that postural core strength that is so necessary.
That's right.
A
We
point.
we can also sit that ball up against the wall.
Right.
You know,
Well,
in case you're afraid of it.
And I was going to say, or get someone like what I call a spotter in, you know, fitness.
That's right. That's a
to,
good idea,
you know,
Mary.
if you can't balance it right away or you start to move and you're a little bit uncomfortable, get someone to spot you or put something on either side so you can kind of grab your balance and hold on to, you know, until you can build up the strength to do this.
Yes, or you could even put your feet on the wall and have the ball next to the wall and have your feet on the wall in the front here. So that if you feel like you're going to fall, you'll have your hands right here. There's so many ways to do it. Don't give me excuses. Get on the ball.
And you can Google ball. I always
Absolutely.
tell people,
Yeah,
if you're not sure, well, I don't know what to do. Google's wonderful.